Hello all. Today we are going to discuss about cardiac murmurs. So cardiac murmurs are heart murmurs, nothing but abnormal sounds that can be auscultated in a diseased conditions. So before going into the disease, let's learn the physiology first. This is something which I have made for making students to understand much easier. So if you can see in this, first I would like to tell about how the blood will circulate in the heart and when are those sounds, natural sounds like lub and dub are created. So first let us start with something known as diastolic phase. In the diastolic phase, what happens is that the blood from the venous blood from the lower body will enter the right atrium through inferior vena cava. The venous blood from the upper body will enter the right atrium through superior vena cava. So through superior vena cava and inferior vena cava, the venous blood enters the heart, that is right atrium. So in the diastolic phase, the blood is entering into the right atrium. In the same way, in the left atrium also, the oxygenated blood from the lungs is entering through 4 pulmonary veins. So through 4 pulmonary veins, the oxygenated blood from the lungs enters into the left atrium. So then what happens is that the pressure in the atrium increases. Both right and left atrium increases. The pressure increases and there will be opening of the 2 valves. So these valves are known as Atrioventricular Valves. Right? The valve that is present in between atrium and ventricle. So these are known as Atrioventricular Valves. So these are 2. Metrial valve and tricuspid valve. Keep in mind, valve means nothing but it is something like a door. Okay, these doors will open and close accordingly. So to make it simple, so these doors are open now. The metrial valve and this another atrioventricular valve, that is tricuspid valve. These 2 valves are open in the diastolic phase. Now the blood enters from the right atrium to right ventricle and left atrium to left ventricle. The blood is coming like this. These 2 valves are open. Right? Now what happens when entire blood was transformed from right atrium to right ventricle, left atrium to left ventricle, suddenly the atria will contract, oozing out the remaining blood into the ventricles. Right? Then what happens? These 2 will close. The metrial valve and tricuspid valve will close. The closure of these doors or the valves, atrioventricular valves, will give you the first sound, that is lub. So lub is the first heart sound heard because of the closure of atrioventricular valves. So clear till here? Then what happens? This marks the end of diastole, wherein the blood is completely filled in the right and left ventricles. Now what happens? The pressure is built in the right and left ventricles. Now the semilunar valve starts opening like this. Semilunar valves start opening. Semilunar valves are again two sets. Those are, see now the semilunar valves got opened. This is known as pulmonary valve and this is known as aortic valve. These 2 are known as semilunar valves. In systolic phase, after the diastolic phase, systolic phase starts. In systolic phase, these 2 gets open. This is pulmonary valve and this is aortic valve. Now what happens? The deoxygenated blood which is present in the right ventricle will go to the lungs via pulmonary artery, and the oxygenated blood which is filled in the left ventricle will go into the body circulation with the help of aorta. So this aortic valve, and this blood will go to lungs via pulmonary valve. So these 2 valves are open in the systolic phase. Once the systolic phase is finished, these two valves gets closed. The doors were shut, the doors were closed, giving a second sound called dub. So dub is the second physiological heart sound that is heard when the semilunar valves are closed. So when these valves are closed, that is lub, and these doors are closed, that is dub. Lub, dub. So these are the two physiological heart sounds that we can hear. Now coming to the abnormal heart sounds. Before going into different types of abnormal heart sounds and their etiologies, let us first try to know that we are telling that because of the sound, or because the sound is because of the closure of the valves, right? The sound is because of the closure of the valves. If these valves get closed, atrioventricular valves gets closed, that is giving lub sound. If these valves are getting, semilunar valves are getting closed, then that is giving dub sound. So here I am telling the valves are closing, means the doors are closing, giving lub and dub sounds. Lub is S1, dub is S2. Any irregular sound that is present between lub, dub, S1 and S2 are known as cardiac murmurs or abnormal heart sounds. So any sounds that are present between S1 and S2 or from S2 to again new cycle S1, they are known as abnormal heart sounds. So keep the point still here. Different types of heart sounds will be there. So if you can see here, this is known as a sound, an abnormal sound, decrescendo. Decrescendo means decreasing abnormal sounds. The sound will be so high, then it will be decreasing. This pattern is known as decrescendo. And this pattern where it starts slowly and increases to a high sound known as crescendo. So this is decrescendo and this is crescendo. And this is pan. The sound will be equally like span. It is throughout the phase. Dull sound will be there, that is pan. Or the other type of abnormal heart sounds will be snap or click. So these are different types of heart sounds. So when we are telling that closure of the doors is giving the sound, then the abnormal sounds are also because of the abnormal closure or opening of the sounds. So that's why any abnormal sound that is created in the heart is because of the problem with the valves. So if there is a valve problem, then it will result in abnormal sounds. So now, what are the different abnormal sounds that are caused and what is the etiology for those sounds? The first major etiology for the heart sounds is that stenosis. Stenosis of these valves. Okay, let us go in this way. Like two types, as I have said, this is one type of valve and this is other type of valve. If at all the stenosis means narrowing down or calcifying, becoming stout, okay, or narrowing down. If at all we say there is a stenosis of this valve, okay, aortic valve stenosis. If we see there is aortic valve stenosis, what happens in aortic valve stenosis? Actually, when the left ventricle is filled, it should open and should pass the oxygenated blood to the aorta nicely with the contraction. But even though there is sufficient amount of left ventricular pressure that is filled up, these valves were not opening because they were very stout, they were very narrow. Suddenly, because of increased pressure, they open with a click and the blood starts with the contraction of the left ventricle. The blood starts going into the aorta. So they are not opening smoothly as in the systolic in the systolic cycle where they open very smoothly. Here they are not opening smoothly. They are opening with a sudden click, an abnormal sound that we can here. So that is a sudden click which occurs, and there is an increase in, suddenly the sound will increase. Okay, the sound suddenly increases means crescendo. So there is lot of blood, lot of pressure that is built here. So the sound has suddenly increased. So crescendo type of sounds are heard. And after crescendo, then what happens? The blood slowly gets decreased in this region. Then what happens is that the blood will go slowly. The sound also decreases. That is decrescendo. And then this will close, giving actually maybe no sound also. So S2 sound may not be heard. So these are known as systolic murmurs. So because of the aortic valve stenosis, we can observe systolic murmurs. Right? A normal dub sound can't be heard. Normal S2 dub sound can't be heard because of aortic valve stenosis. So that is what is systolic murmurs. Coming to the other valve, that is metrial valve stenosis. What happens if metrial valve is stenosed? So when there is good amount of pressure and ready to ooze into the right ventricle from the right atrium, when the blood is ready to come into the right ventricle, what happens? It will not open. It will just open with a snap. So it will open with a snap, okay, and slowly the blood comes from the right atrium to the right ventricle, very slowly, because there is narrowing and calcification of this valve. So the valve getting narrowed. So the blood can't smoothly go into the right ventricle. So there will be a dull sound or murmur that is created. The first S1 sound can't be clearly heard. So that's why during this type of murmurs which are occurring because of the metrial valve stenosis is known as diastolic murmurs. So here it is systolic murmurs and here it is diastolic murmurs. So systolic murmurs, their S2 sound may not be heard. In diastolic murmurs, S1 sound may not be heard. So these are abnormal heart sounds in the stenosis of the valves. If the stenosis is one cause, they are stout and narrowing down and they are becoming thickened. So stenosis is one problem. Opposite to that is weak, leaking valves. So before the valves are so tight, very rigid, they are not opening. Now the valves are becoming loose. They are leaking. So these are known as regurgitating valves. So again, let us see. This valve is regurgitating valve. Okay. Actually, this valve should be closed. When does this valve will close? When there is a diastole. When there is a diastole, this valve is closed. But even during diastole, if this valve is opened, right? Even during diastole, if this valve is open and there is leaking of this aortic valve regurgitations, right? This is known as aortic valve regurgitations. Even during the diastole, when arterioventricular valves are open, there is leaking of this valve, this left, and then this is called the diastolic murmurs. And when this valve, during systole, this valve should be closed, right? Only during diastole, no, this should be open. During systole, if this valve is not closed and this is again leaking, this will, throughout the systolic phase, this valve is open, giving a pansystolic sound. So this valve is open throughout the systolic phase and leaking. The blood is oozing. That's why throughout the systole it is giving. That's why it is pansystolic murmur. So these are different types of cardiac murmurs. Simply to understand, I have given a small table here. You can see here, this is semilunar valves, arterioventricular valve, stenosis, regurgitations. So semilunar valve stenosis will give you systolic murmurs. Semilunar valve regurgitations will give you diastolic murmurs. Arterioventricular valves stenosis will give you diastolic murmurs. Arterioventricular valve regurgitations will give you systolic murmurs. So after listening to this will be like a summary. Then the other important point is that where do you really hear or auscultate for different valve problems? At the apex region, we can appreciate mitral valve defects. Just above the apex, in the sternum region, we can appreciate tricuspid valve abnormal murmurs. And in the base of the heart or top of the heart, we can appreciate pulmonary or aortic valve murmurs. So this is about the cardiac murmurs. Hope you have understood. Thank you so much.